Hey Brianna, my name is Jonathan. I'm your nurse today, and what we're going to do is we're going to do a physical assessment on you, okay?
Okay.
Alright, what we're going to start with is we're going to start with your head, okay? I'm going to inspect your skin, your face. Your skin looks good. There's no redness noted. It's not oily. It's warm to touch and dry. Um, is there any tenderness, anything wrong with your face when I touch it?
No.
Nothing? Okay, good. Alright, what I'm going to do is I'm going to palpate your cranium. And I'm going to feel around and see if I feel any knots, any bruises. Is there any pain, any tenderness there?
No.
Good. Okay, so I want you to smile for me. I'm going to check for symmetry. Your face looks good and symmetrical. Nothing wrong there. Alright, I'm going to palpate your temporal arteries. Okay. Good. Temporal arteries feel good, no problems there. Alright, what I want you to do now is I'm going to feel your jaw and I want you to open your mouth for me. Okay, good. Do it again. I'm assessing for TMJ, and it sounds like you've got a little pop there, and it might have some symptoms of TMJ there, but we'll focus on that later. What I'm going to do now is we're going to assess cranial nerve number 5. To do this, we're going to get you to clench your teeth. All right, I'm going to push down. Okay, good. There's nothing wrong there. That looks good. So now we're going to test cranial nerve 7, okay? And I want you to smile for me. Okay, frown. Okay, lift your eyebrows. Okay, show your teeth and puff your cheeks out for me. Good, alright, good. Everything looks good with your head and your face, so we're going to move on to your eyes, okay? So what I'm going to do is I'm going to get you to stand up here, and I've got a Snellen chart here for you, and I already marked off it about 20 feet. So what I want you to do is I want you to, excuse me, I forgot to get my eye blade. Should take the blade there, and I want you to cover your left eye for me. And I want you to read this line down here for me, okay? The farthest line you can read, okay?
D, P, C, Z, L, L.
Good. All right, I want you to cover your other eye now for me. And I want you to read as far as you can this way.
D, P, C, Z, L, L, T.
Good. That's 20/15 in both eyes. That's good, okay? All right, you can take a seat. You give me that. All right, so what we're going to do now is I'm going to check you for any kind of extraocular movements. I just want you to look straight ahead for me. Good. Good. No extraocular movements noted there. So what we're going to do now is I'm going to take my pen light. I'm going to look into your eyes. I do see your eyes are accommodated. They're reactive to light. They're equal. They're round. Your pupils are about a 4 to a 5, somewhere in between there. What I'm doing now is I'm going to kind of just feel around your eyes. I'm going to kind of palpate. Do you feel any tenderness, any problems there?
No.
Good. Your eyebrows look good. Your eyelashes, eyelids, everything looks fine. No drainage coming out of your eyes. Open up for me again. Your eyes, excuse me. Let me look again. The sclera is white. The conjunctiva, no redness noted. The iris is green. Everything looks good there. So we're going to move on to your ears. What I'm going to do is I'm going to inspect it. Kind of palpate it a little bit. Any tenderness? You feel anything?
Mm-mm.
Good. There's no drainage, no redness in that ear. The same with this one, no tenderness.
Mm-mm.
Okay, good. All right. What we're going to do now is called the whisper test. Okay.
Okay.
I'm going to cover this ear, and I'm going to whisper a word to you, and I want you to tell me what it is. Okay.
Okay. Baseball.
Okay. This side.
Football.
Good. Good deal. All right. So now we're going to move on to the nose. So first thing we're going to do is we're going to inspect your nose again, kind of palpate. Is there any tenderness there? No? Good. All right. It looks good. It's symmetrical. So what I'm going to do now is I'm going to try to test for patency. What I want you to do is to occlude one nostril for me and just kind of suck and blow through it. All right. And do the other. Is there any congestion that feels patent? Air going in and out good? All right. Good. So what we're going to do now is we're going to do I'm going to assess your maxillary and your frontal sinuses. Okay. Okay, good. There's no enlargement noted there, so that's all good. So we're going to move on to the mouth and throat. So I want you to open up real wide for me. Okay. All your teeth look intact. Your gums look good. The mucosa is pink and moist. Your tongue looks good. Stick your tongue out for me. It's symmetrical. I'm going to take my tongue blade. The gag reflex is there, and I want you to open up and say ah.
Ah.
Your uvula is midline. Your tonsils, I can kind of see them a little bit. They're not real big, but I can see them a little bit. Stick out your tongue again. I didn't get a good look at it. Yeah, it's good and it's symmetrical. So what we're going to do now is we're going to move on to the neck. Okay, and the first thing I'm going to do with the neck is I'm going to look at your lymph nodes, and I'm going to palpate each lymph node. Okay, so I'm going to start with the preocular lymph nodes. Okay, move on to the occipital, back to the post-auricular. Okay, and then work my way down to the submental, the mandibular, the tonsillar, posterior cervical, the deep cervical chain down each side, and then the supraclavicular. There's no enlargement noted there. Everything feels good. So what we're going to do now is we're just going to check your range of motion. So what I want you to do is I want you to take your chin and I want you to put it to your chest for me. I want you to move your neck side to side. Good. All right. I want you to take your ear and touch it to your shoulders, each one. Good. All right. I want you to do your head backwards for me. All right. Your range of motion of your neck looks good. No problems there. Let me look at your trachea, inspect it. It's midline. No deviations noted there, so that's good. I've got some water here for you to drink. When I tell you to drink. What I'm going to do is I'm going to fill your thyroid as you swallow. Okay? So take a drink and swallow it for me. Good. All right, your thyroid, I can feel it a little bit. It's firm, but it's not enlarged. It feels good. No problems there. So what we're going to do now is I'm going to check your carotid pulses. I can feel that one. It's pretty strong. I can feel that one. It's pretty strong. Maybe bounding a little bit. It feels pretty strong. So what we're going to do now is I'm just going to listen to those, make sure there's no bruise noted with the bell of my stethoscope. Good. No bruise noted there, so that's good. So we're going to move on to your chest. And what I want you to do is I want you to lie down for me. I want you to lie on your back for me first. I'm going to inspect the back. So turn around and inspect the back first. We're going to do the posterior chest. So lie down on your stomach for me. All right. Raise your shirt up a little bit. Raise it all the way right here. And what I'm going to do is I'm just kind of inspecting it, palpating it. Everything looks good. There's no trouble there, no problems noted. What I'm going to do is I'm going to test your tactile fremitus. And whenever you feel me touch your chest, your posterior chest, I just want you to say the number 99 for me, okay?
Okay. 99, 99, 99, 99, 99.
Good. So I know it's good. Expansion there, it's symmetrical, everything's good there. So what we're going to do now is I'm going to assess for the costovertibular area. I'm going to palpate it, see if there's any flank pain noted. Is there